Hi, I'm Ashley, and I'm one of the wildlife rehabilitators here at Portland Audubon's Wildlife Care Center. My video is going to be going over the basics to wild animal capture and handling. I do want to stress that this is just the base knowledge that is going to be of great help to you as you begin your in-person hands-on training, but there's no need to leave this video feeling 100% confident and like you know what you're doing if I asked you to grab something just yet. So let's get started, and I'm going to make my video much smaller so it just doesn't get in the way of my presentation. All right, so when and why do we handle animals at the Wildlife Care Center? It is really only when necessary for care. So that's during initial examination when we're finding out what's wrong with the animal, during treatment, whether that's daily or every few days for shots or whatever it is, and during daily cleaning and feeding, although usually for daily cleaning and feeding, we are just capturing them to put them into a secondary container, and then they're going back in. We're not actually handling them. So just point that out here for a sec. All right, so the biggest thing that I want you to take away from this is that we want to respect our wild patients. They are not like our domesticated animals at all. They do not and should not respond the same way our pets do to common things like how we talk to them or our touch. So we really, really want to keep that in mind always. These animals are wild. They're not having fun when we're handling them. Even if we're having fun, we're not doing it just for fun. We are strictly doing this to help them get back out to the wild. So often people think that sounds like we don't give any love at all to our patients. But I would like to just say that this is a more extreme love. This type of love is, I want to get you back out to the wild and I want you to survive. It's not the possessive kind of love where, not that our animals at home need to be a possessive kind of love, but it's a different kind of love. So I just want to make that really clear. So some things to keep in mind, there's a few. The very first is your safety. So knowing, accounting for, and maintaining control of all of the weapons that these animals come with. So there are talons, there's teeth, there's some things you might not even have thought about, like skunk spray, a chemical response, and even wings. So geese will do this, pigeons will do this, but wings can be weapons and they can definitely slap you with them. So knowing all of the different items that they can come for you with is very important. The next thing to keep in mind is that we don't want to do any harm to our patients. So we obviously don't want to make, or we do want to make sure that they're breathing and that that's not being restricted by how we're holding them. We also want to make sure we're not hurting their injuries that are already there. So I put up this picture of the front of the cage of a red-tailed hawk that was in care at the time. And it tells me right here, he's got a left humerus fracture. So going into the cage and knowing that will help you maybe not put so much pressure on that side, not cause undue stress or harm to that animal. We also won't want to damage feathers, which I'll go over a little bit once we get to the handling aspect. But the biggest thing that I want to push into you guys today is this minimum effective restraint idea. So MER, it's basically balancing the fact that these animals are dangerous, and yes, I want their weapons restrained, but we don't need to be so brutal about it. We don't have to, use all the strength that we have. We want to use the minimum that can hold them in place, and not, it's going to be more stressful if you're doing things a little bit more rough-handedly. So just think about that as you're going about. All right, something else to keep in mind, the fact that this is very, very stressful for every animal that's here. So we try to minimize stress in every way that we can. You will be asked to move about quietly throughout the whole care center, but especially in the rooms where there are wild patients recovering. We also ask that there is no unnecessary talking near our patients, but especially to the patients. This is a big no-no. There's no need to ever talk to the animal. But there is a very real reason to communicate once you're handling something dangerous. We use the words "got it" a lot. So before I come up to you, if you're holding a hawk for me, you're going to say "got it" before I even approach. Or if I'm taking a leg from you, I'm going to grab that owl's leg and I'm going to say "got it" before you let go. So that's something we'll definitely go over more in person once you're practicing here. But I just want you to know that it's not that you can't ever talk. We definitely want to communicate about things that are important, but we don't want unnecessary talking and sounds that are just going to stress our patients more. The next thing is to work efficiently. This is going to keep the encounter brief with the animal. So this is having all your tools ready to go before you even grab that animal out. But it can also just be working quickly to make sure that you are spending maybe just seconds or maybe a minute or under with this animal before it goes back into another safe location where it doesn't feel like it's being restrained and it doesn't have human hands or eyes on them. The next thing you can do to minimize stress is keeping the animal in a comfortable, natural position when restrained. I'll show you some photos of this later on in the presentation, but this will definitely keep your patient calmer. If they're in, if this bird is used to standing upright, I should try to keep him that way. I don't want to lean him forward like a duck. I don't want to place him on his back just for no reason. I want to keep him in the best comfortable position possible. And we do try to cover the eyes and head as much as possible. This also will get rid of stress. If an animal can't see, they usually aren't too scared because they can't see what's going on. So that'll really help us. All right, next thing to keep in mind is that when you're handling an animal for somebody, it is for a reason, like we talked about earlier. So patient monitoring and treatment needs to be possible. Otherwise, there really isn't a point to why we're handling this animal. So you'll notice in all three of these pictures, either something's being done. There's blood being drawn here, there's an eye exam going on, and there's some type of subcutaneous something going on here. So in all three of these cases, the bird is still being restrained, but we're able to do the things that we need to do. And you'll get better at this as you learn more skills. So this is a one-handed hold that allows this other hand from this person to be free. This hold, similar to the football hold we'll go over later, but it allows you to hold on to a leg or maybe the head if needed. But a lot of these positions are going to be just kind of learned on the job. There's not really a way to account for all the different scenarios and all the different treatments that could be possible here. So we'll go and learn as it happens. All right, preparing to handle an animal. So like I said before, to work efficiently, you're going to want to have everything ready before you even open the cage door. So here's a few things you might need. All the medication and treatment tools. Usually staff will be worrying about this, but you should probably check in with us and make sure that we're ready to go too. If you're not currently getting medications drawn up for yourself, either way, you're going to need somebody to give it, but you definitely want to make sure staff is ready to go too before you are. You might need goggles for certain species. You usually need very basic gloves. Pretty much we use a towel for everyone. And you might need these thicker leather welding gloves, depending on what species we're talking about. So knowing what safety gear, also known as PPE, you will need is something you'll definitely feel more comfortable with once you start handling these animals, but just a very basic breakdown. Most, if not all animals, you can use those nitrile gloves. Not only will that protect you from zoonotic diseases, potentially coming home with you or being on you in the first place, but it will also protect the animal from you. There's a lot of things we don't think about, but our fingers have tons of oils on them. So this can be bad for amphibians, but this can also be bad just for birds and their waterproofing. So nitrile gloves usually create that barrier that we want in between you and the patient. Next are goggles. So you can probably guess who would need goggles worn around them, but it's all of our long-necked, pointy-beaked birds. So think great blue heron, common loons, grebes, all of these guys that basically want to hunt your eyes. So you're going to want to wear goggles just in case they get to that point where they're able to strike, so that that doesn't happen. Next is leather gloves. So birds with talons, you're definitely going to want this. Hawks, owls, falcons, things like that. The only kind of thing that can be tricky is finding a balance of the dexterity that you need to do the job and having enough protection. So we've got many different sizes and thicknesses of gloves that you can get a feel for once you're here in the building. We've got all different sizes too, so you can find your perfect fit. But it is just kind of a balancing game. Same thing with birds with stronger beaks, maybe gulls, even a raven has a really strong beak that can do some damage, but small mammals with claws and long teeth too, you can always wear our leather gloves as well. Probably would just opt for the thinner ones so you have more dexterity. Don't want any injuries, but it is always a risk when you work with wild animals. All right, so let's get into some positions. These, again, this is very, very basic, but one of the main positions that you'll start with here is the bird bander's grip. So what I would say is our easiest patients to capture and handle, although they're still a little bit tricky, are our smaller songbirds and our ducklings and goslings. All three of which you're going to kind of hold in a similar way. But if you notice these fingers, it's your index and your middle finger, just create a space in between for the head of the patient, but the two fingers kind of drape down in front. Not only will it not apply pressure right here to the keel of the bird, but it'll just create a really, I don't want to say firm, but it'll create a good hold on the bird. It won't feel like you're choking them. You're not putting fingers directly around their neck or encircling their neck. And having the thumb and the other three fingers to kind of grab the rest of the body usually just feels very secure. So you can do this on a duckling. So one of the first animals that you can help us with are usually our ducklings. That's kind of the starting point for our new volunteers coming in. And they can basically just, open up your two index and middle finger, and you just slide that behind their neck, wrap your other fingers around them, and they can just, be grabbed way faster than you would think. Usually if I've got ducklings in a cage and I ask you to clean them, there's going to be like 10 little faces and they're all running away from you, but this grab is going to be your best friend. It'll also help you not drop them and not accidentally cause injury to them. This is a basic two-handed hold for, a more medium-sized bird. So think ducks, mallards, and the like, gulls and other things around that size. But this is more for birds whose feet and beaks are not particularly dangerous. So if you notice, this bird isn't having his legs restrained. We don't have a hold on each of them. They are propped up and folded up underneath to be supported, but they're not actually held and being restrained in the same way that we would on an owl. Same thing with its head. Usually I would have a towel over both of these patients. But if I need to access their head, I can do that too. But just imagine there's a towel draped over him. And I don't need this person to control the head either, because the beak is not particularly dangerous either. Something you'll notice about this is the same as the last picture. There isn't any direct pressure being put on the keel. That's what we want. All birds have to expand to breathe. So you really don't want to hold them that firmly or in the right place or in the wrong place that you're restricting that airflow. So just keep that in mind. And the next hold is a variation of that one. So you might start with the basic two-handed hold and then move to a one-handed hold if you need to control the head for some reason. But it really is just a football hold. This will be like mallards and smaller. You can just kind of use your body as that second arm to keep that wing pinned in. And this will keep that outer part pinned in, and still want to make sure we're not applying pressure to the bottom of the bird and supporting its feet. All right, here is the infamous two-handed raptor hold. So this, I think, can be intimidating for a lot of volunteers who have never held wild animals before. Once they're held like this, they are a little bit more calmer. A hood does help too, covering the eyes and just keeping their stress levels as low as possible. But this proper position for handling also really helps keep him calm. So you'll notice that the wings are pinned, so they're underneath this towel, but they're pinned, and I'm keeping my elbows in to not let those fly free. Eyeballs are covered. The bird is held upright in a normal position. This is the same position they would be on, or they would be in if they were in their cage. They have their back up against my stomach, so they're supported from the back. I've got their talons under control, and I've got a safe distance in between my face and their face, just in case. So here's a quick video of, oops, let me make sure that it's gonna play right. All right, so this is a video showing you the two-handed grip. This is a euthanized barred owl. So this patient is already deceased, but I'm just using him to show you guys some of the maneuvers. So there's the two-hand hold. I got my thumb and my index finger, or all my fingers, wrapped around there, but most importantly, the index. Then I can use my middle finger to grab that second leg if I wanted to switch to a one-handed hold. So two-handed. Ooh, I thought I was going to do it again. Let's see it one more time. So a two-handed hold, and going from a two-handed hold to a one-handed hold. All right. This next video is going to show you the same hold that I just did, but you'll often be asked to lie the patient on their back. We give subcutaneous fluids for hydration, sometimes in the tissue that connects the leg to the body in an area called the inguinal area. So I may ask you to do this, but this is what it looks like. You kind of lift the patient up and make sure the towel stays underneath. If you notice, I made sure that the tail was above the table before I came over, so I didn't just kind of let the tail accidentally go behind the bird. I still have it in this two-hand hold. I still have the face covered, and I still have my elbows in to be supportive to the patient. I just need to get to this laying down position. And you can do it in a one-hand hold or a two-hand hold. It usually just seems like getting to this position can be tricky for people. So let me just show it one more time. All right, the last thing I'll point out is I did come pretty close to this wall. If you've got another person on the side of this table helping you, you can either ask them to step back if you need more room to bring the patient up, or you can just be conscious that they're there and maybe not try to go as high as I did, but just high enough that you don't catch their tail feathers on anything, and you're able to get them into that position in a quick fashion. All right. Holding the head. So this can be done in a lot of different positions, but it seems to be one that really scares volunteers. So, and I don't think it's scary in the sense that, yes, the bird could bite you, but I think for the most part, volunteers are really worried about hurting the bird. You're holding onto its head. Its eyes are definitely there. So you just want to be kind of conscious of it. But unless the eyes are injured, you don't need to worry too much. Usually their head's going to be covered by a towel unless I need to do something. But for the most part, if you're holding on to the head the way you should be, you shouldn't come near the eyes. So you actually want to hold at the base of the skull or around the jaw. Even in this hold that we're doing, you might see these fingers wrapped around, but a thumb is underneath to really have a good grip there, but also to hold on to the strong part of the bird's head and not apply pressure to these softer, more delicate areas. You also want to make sure you're not putting encircling pressure yet again on their neck. So you don't want to hold their head in place by holding onto their neck right here. You really do want to hold onto their head. You also don't want to hold their beak clamped closed. Some animals, depending on their species, can suffocate from this. So not every bird has nares they can breathe through. And rather than try to remember the species that has that issue, just don't hold their beak closed. Yeah, that's the best way to not run into an issue. Just don't do it. All right, so what about holding this little guy? You'll often be confronted, if that's the word, with really tiny baby birds. Do you need to grab gloves and a towel and goggles even, or anything like that to hold this little guy? Probably not. You might want to wear nitrile gloves, but honestly, if you're in the back room with the babies, picking these little guys up is just as easy as you would think. You just pick them up, plop them somewhere else. Definitely want to be gentle with them, of course. Don't want to accidentally drop them or anything like that. But just placing them in your hand and having whatever container they're going into nearby, so there's not a long journey to go, is the best way. But yeah, you don't necessarily need any tools. I know it can look really scary because all their organs are visible and they just look so delicate and funny. So don't be too scared, and we can always show you that first time around just how easy it is to pick up these little nuggets, but just wanted to throw that in there. How about this little guy? This is a fledgling, or he's almost there. So I would actually go with the bird banders hold. So unlike this little guy who's not going anywhere, these guys will actually jump or flap or do things that'll catch you off guard. So I would go with the bird banders hold. Slip my fingers right around the head and keep him as contained as possible. Once they're any bigger than these little roly-polies, jump to bird banders hold to be safest. All right, I'm just going to do a quick touch on small mammals. We really do mostly avian species here, but same thing like I said before, you really want to hold the base of the skull or around the jaw. For a bunny, you're going to want to tuck their little butt and legs underneath. You don't want them kicking their legs back. They can hurt themselves and even kill themselves that way. We're going to pretend that weird creature is a skunk, and I'm going to tuck his butt under so his tail is tucked and he cannot spray me. Once their tail is tucked, they cannot spray. So if that's, let's see, one more take, maybe like a chipmunk or a squirrel baby that I'm asking you to do something with, you're just going to hold the base of that head. Perfect. And just a quick touch, we really, we don't have that many small mammal patients coming in, and they are often being cared for by staff frequently. So you may need this, but we'll definitely give you way more training in person before we have you touching a small mammal. All right. So what not to do? Sometimes you'll know it when you see it, but is this a very comfortable way to pick up a rabbit? No, we know that. But this doesn't look that uncomfortable, but what's wrong here? This head is not under control at all. Not only that, but it's not covered. Not covered at all. And he's backwards, so I don't know, lots wrong here. And here's just a funny meme that Stephanie had found for this presentation, but just look at how badly this dude is handling this bird. So he's got his arm under one of the wings, and this one's actually drooping down. So both wings are not contained at all. You got your legs draped down, which not only is not good for the animal to have your arm wrapped around their keel and maybe not being able to breathe, but these look like they might have talons. So those should be really restrained properly. There's no towel over this animal. It's looking out. This seems pretty close for this big of an animal to be just loose next to your face. So this is just a really good example of how you should not be grabbing our patients. Here's a few more what not to do's. So we're never going to be taking pictures with our patients. You'll often see officers do this before they're bringing patients to us, which we're always happy that they helped us, but we do wish they realized that this is actually extremely stressful. So this bird's got some feathers up. He's got his wings draped down because he's probably extremely off balance, however this man is holding him. So not a good situation at all. Same thing here, this peregrine falcon is not covered at all. But besides that, look at the way they're being held. This is referred to as the ice cream cone hold. A lot of biologists will use it. It is not actually a great hold for anything. If I needed to do something to this patient, its wings are being kept the same place as its feet are. So I can't separate out this wing without you adjusting your hand. There's also not an index finger in between these 2 feet. So it's pretty easy for this bird to slip out and possibly grab somebody or possibly just escape. So this is not a great hold either. I don't even know what's happening here. There's got a wing drop down here. She's encircling his head. They at least know enough to be wearing gloves, but their hands facing the wrong way. This leg's all bent up weird. And this is just not a great situation for this bird. This is very uncomfortable. Same here, one wing out. It looks like maybe the feet are under control. Maybe not, I can't tell for sure. And we've got a whole hand wrapped around that guy's neck. Again, does not look comfortable at all. And then I included this picture because it's something that's not often thought of as bad, but we don't want to be handling wild animals, even if they're choosing it. So even if the bird wants to step up onto you, that is not what we want. We want them to be wild and we want them to have the best chance at surviving out there. So yet another bad look, although he doesn't look like he's all bent out of shape like these guys are. He's still going through some type of stress, risking being that close to a human and not reacting the way that they should. So some proper capture techniques. And again, everything I've gone over, we're going to be doing in person, and you're going to be doing this with supervision first before you're ever sent off on your own to do it. But safety gear is basically secondary. If you have good capture and handling technique, that's what's gonna give you the best results. So if our skills are good, the animal should never even have the opportunity to grab at us or strike at us. But these safety gears and things we put in place are obviously, because it can happen. We just want to make sure that that's not the usual. I don't want to have or for you to have talons poking through your gloves, or maybe this time the grebe just poked you in the cheek and it missed your eyeball because you're wearing goggles. We don't want those things happening, even if they don't result in injury, because that also means that we're lacking somewhere else. We want to make sure that you guys have good capture and handling techniques all the way around, but definitely we will never get rid of the safety gear. My best advice for capturing animals is moving slowly and quietly, yet confidently and deliberately will definitely help you in the long run. You don't want to second guess yourself. So you don't want to be poking in and out of the room. You're giving that animal time to realize what's happening and time to react. So you definitely want to get the capturing process down to only taking maybe a minute, if that. But learning and knowing when to stop is also a big thing. So you're going to want to not only pay attention to how much time it's taking you, maybe even setting a stopwatch so you get better with your time, but you also want to make sure that you're paying attention to the animal's stress levels physically. So if the bird is open mouth breathing and he's really obviously stressed, you can stop at any point. We can recapture that animal once they're doing a little bit better, but we don't want to throw them overboard by continuing to try to grab them when they've already had too much. So here's the main way that I might ask you, go grab that bird out of that blue box. So I'll go over it in a more step-by-step in the next video, but basically I've got a towel ready. I drape it over. I try to make sure that that animal can't see out. Try to make sure that their head is covered, that I've got a good hold of their body. And there's me making sure I've got the legs grabbed. Perfect. Maybe I'd want more towel. Yep, I was just thinking it. I want more towel up by the head just so he's completely covered, but that's the very, very basic what I'm asking you to do. Same thing out of a small plastic container. So probably songbirds will be in something like this, but you'll do the same thing. Pop the lid off. Try to drape that towel over as much of the enclosure as possible. And then for songbirds, you're really just scooping them up. There's not a whole lot of weapons that you need to have under control before somebody starts doing something. You might want to have them in that bird bander's hold for sure. But once I've got them wrapped in the towel, if they're just going in another container, then maybe not so much. All right, so now I'll kind of do a step-by-step, and you can see it from out of a bank cage. So when we refer to bank cages, these are these cages off to the side. So you'll notice, same thing, I've got the towel draped. As I'm opening the door, I'm just trying to make sure as much space is covered as possible. Less lights getting in, the bird sees less outs, and then I just move toward the animal and or hopefully the back of the cage as well, slowly, quietly, and kind of quickly. If you noticed, I'll play it again, but I just kind of ran right up on him. You're going to bring the towel down over them, having a little bit of extra towel at the top so that you have room to cover their head is always great. Although you can adjust afterwards as well. So once the head is covered, weapons are secured, you've adjusted all that you need to do, you can step away from the cage to face your assistant that might be helping you and just communicate that you're ready. You can say, got it. It can be a nod, however you want to go about letting your helper know that you are keeping them safe, you're safe, and you're ready to go. And there's just me switching to a one-handed hold again. All right. Now, okay. Songbird cages. So capturing a songbird when it's just loosey-goose in here. So they are ping-ponging all over the inside of this this cage, although you'll notice, I don't know if you can tell so much from the video, but you will notice in person that they are completely soft-sided besides the PVCs that are keeping them upright, they are soft-sided. So although you might hear them flying around, they're at least not hitting anything traumatizing. So here I'm just going to show you that there are very different access points that you can come from. I like coming from the side to grab certain birds. Sometimes I'll slip a net in that side, so I don't even have to try to grab them with my hand. But there's this same hole that I showed opening here. Up on top, you can come from above. That zipper I open on the side goes on 3 sides. So not all the way around, but on 3 sides. So you can move those zippers around. You can maybe want to come in from the bottom, but all of these angles that you can come in from will just help you have less escapees and less birds possibly getting hurt falling to the ground. So what do you do when an animal escapes? Usually the first thing you'll hear is somebody say bird out. That just lets everybody in the vicinity know that there is an escaped bird. It usually means don't open any doors, don't come into this room. And it usually means things are going to start crashing around in the hospital if the bird is not contained soon after. So you'll definitely either have nets ready if the bird has a flight risk sticker on its cage that lets you know that it is definitely going to try. Or you can just have a net available on the side of the bank cages where they live. So if one escapes, we can quickly run over to them. If you're not able to capture the bird, you know, pretty soon after it escapes, you might have to go get more help. Sometimes it does take 3 of us wielding nets to get that little sapsucker back in its cage. So don't feel too bad. It does happen. Our patients want to escape and they're very good at it. So it can and will happen. We just have to know how to respond quickly and efficiently so nobody gets hurt more than they already were when they got here. So what to expect next? On the job demonstrations will be done. You will definitely get to see other volunteers performing this capture and handling techniques. And you will have time to do lots and lots of practice with dead birds. So we usually have carcasses that you can show me the holds on. So the holds that we just went over, you can practice them and get a feel for them on a creature that is shaped like the ones that you're going to be handling, but at least they're deceased, so they are not being practiced on while they are stressed. The next thing that is to come is you will have a checklist and advanced skills training, and we will start learning on live patients. So sometimes you get a feel for these holds on these birds and you're like, that is awesome, I can do that. And then you add in all of their behaviors. So he's going to try to zoom away from you. This guy's going to look you dead in the face. He's going to show his scary claws. He's going to put his wings out. He's going to raise his feathers and just try to look as big and bad as possible. And he's probably going to bounce around the cage trying to get away from you. So nothing can really account for the way wild animals behave other than, you know, practicing in person and getting a feel for each species and their reactions to different things. But I cannot stress how great hands-on experience is when it comes to handling. There's just not anything like it or anything that can really prepare you for it before you start doing wildlife rehab work. So I hope this excited you and gave you some background knowledge to make you feel comfortable coming in. And don't worry too much. You've got this. I know it might seem like a lot, but trust me, you've got this. We've got volunteers, all age ranges. Some have been here for 20 plus years. Some have been here just for months. And we do everything we can to teach you the skills that we have so that you can feel as confident capturing and handling these animals for us as we try to rehabilitate them and get them back out to the wild. So if you have any questions or concerns about the video, just forward them my way. Otherwise, this should come up. This information should come up on a quiz next, and hopefully I'll see you in person for some training. Thanks. Bye-bye.